One of the interesting things about our practice is folks come from a lot of different places to see us. We provide excellent care and very highly specialized care that you normally wouldn't find in a small community hospital. You usually have to go to a big hospital.
We can handle shoulder, elbow, hand, wrist, hip, knee, foot and ankle. We do trauma, we do joint replacements, we do sports medicine.
We also provide a lot of procedures that we can do in the office. We have a physical therapy facility right next door to us in the same building, which is great because that allows our patients to have care right next door to us. And if there's an issue, the therapist will come and find us and evaluate the patient right there and then.
We can schedule all of these things to be performed at Walter Reed Hospital. We have immediate access to the labs or the studies of the procedures. The continuum of care is quite fantastic.
We just started allowing walk-ins, and that's really beneficial for patients because sometimes there's a couple of day wait for orthopedics or any specialty. And the nice thing about the walk-ins is you can come in when you're hurting. So now we can see people that day when they're having their pain. It makes it much easier to assess and easier to help them resolve their problem.
Every time my wife calls, they get me right in. I was here 2 weeks ago and drawed 85 cc's of fluid off my right knee. It hurts all the time. I couldn't do anything with it. And he recommended me, if I don't do something with it in the next year or so, I'm gonna end up in a wheelchair. So we went ahead and did my left one, and it turned out perfect. I'm doing my right one this fall.
This procedure is 90+% success. The residual discomfort after this, which is present in about 10%, is around the kneecap, which isn't on this model. I would say that the best solutions we have out now are hip replacement, shoulder replacement, including reverse, that's an excellent surgery, and knee replacement. These procedures, if you're looking for a definitive solution to your arthritis, these resolve it.
When I met Dr. Hospital, we talked about it. He had looked at the x-rays, told me that I was definitely a candidate for a hip replacement. I told him, well, the shot's not lasting any longer. We just scheduled it from there and did it. But now I can pretty much do a lot of everything I did when I was younger.
It's really nice to see someone who comes in maybe crying in your office in a lot of pain, and then when you can help them with that and fix that, then they come in later and they're so excited and just showing off for you, showing their new movements, showing what they can do. They love that, and it's really nice to see.
He would ask me, can you get your hand over your head? I couldn't do like this or like this.
I'm knock-kneed. He also straightened my leg. And he's got to do the same with the other one. My right knee looks terrible. It don't even look like a knee. But he's going to straighten that and fix that like this one. And I got faith in him. I want him to do it.
You know, that's the nice thing about orthopedics is that you definitely see progression and growth. So you get to see that every day with patients.
An old gentleman in the parking lot I talked to was 82 years old. He had, Dr. Perez did both of his. He got the way he couldn't work on the water. Now he's back working his own boat at 82 years old.
I can be almost anywhere, and I'm gonna run into somebody who had something done that either I did it or maybe Dr. Perez did it, and they come up and tell you their success story. And when people come back and they dance around in the office or they show you with their hands up how great they've done, that's what does it for me.
I don't consider my job a job. I consider a blessing what I do for other folks. I was a patient once when I was 18 years old. I was in a big traumatic accident and I was taken care of by very good doctors. The way I look at it, this is a way for me to pay that back.